It's amazing to be here in Utah, especially someone who grew up in this neighborhood. Obviously, we named our company after the tallest mountain in North America, but in reality, we named it Denali because I grew up in the Wasatch Range. I'd wake up in the morning, especially during this time of year, and would look for the snow that would fall in October and November, and was always inspired by mountains. And I'm so excited that I now work for a company that is named after this mountain and the huge unmet need that we're going after. And today I'm going to tell you really one story and share two pieces of data. And that's it, which is unusual for me because I love data. And usually my presentations are just full of data. And that's really how I like to approach what we're doing, in part because data is what's going to drive success for our patients. I'll start here with this slide. So let me just make sure we're on here. Basically, what I'd like to share with you is that we are a company, but actually we're organized as a purpose. We're focused on four major areas. One is rare neurodegenerative diseases. The second is ALS or FTD, and these are also rare, but not as rare as, let's say, lysosomal storage diseases, and then Parkinson's disease and Alzheimer's disease. And again, the company is really focused on inventing medicines for this therapeutic area. But I want to share with you a little bit about the people that I work with, and I think it's really important to our overall purpose. And I'll share this video.
For me, I do have a personal story, is that my grandfather, he basically totally lost himself to dementia in his last years.
My grandmother actually passed away from Alzheimer's. She started developing dementia in her 80s.
My whole family gets Alzheimer's disease, and so I've known that this is what I wanted to do since I was in middle school. And so for me, being here...
My dad started getting the symptoms of Alzheimer's, and so timing-wise, my
grandfather had Alzheimer's, and my dad being the oldest of the family, my grandfather lived with us.
I think her early memory challenges happened about six, 7 years ago. And I think we were in that state for about 3 years.
So it's actually really great to have
my dad was born in 1936,
still
his parents...
I mean, growing up in a family of 7 children was pretty extraordinary. I had 5 older brothers and an older sister, and my mother was amazing. Hey, Mom, what do you remember most about our childhood when you raised 7 kids and you raised 6 boys? What do you remember most?
I just had so much fun. They got around, and that we had where they would go back and around the boys,
They'd run around the family room, and then they would hit each other with pillows, right? And you tried to pretend like it wasn't happening because people would just be getting hit with pillows all the time.
Oh, yeah.
I think her early memory challenges happened about 6, 7 years ago. What I've noticed in the last 2 years is that she cannot be alone. So it's been really challenging. I think actually the challenge with Alzheimer's disease is probably more on the caregiver than the individual. I think in the case of my mother, besides being paranoid and not as socially engaged, she is very happy, and I think the real challenge has been for my dad to take care of her. I believe the effect of something like Alzheimer's disease in a family, where you see family risk, is sort of this underlying, again, anxiety, and this anxiety of someday I'm going to lose all the memories that I'm creating, and yet there's a sense on the one hand of hopelessness, and on the other hand that there's great hope for the future, because this is where we were with cancer 20, 30 years ago. There was no hope. And certain cancers now are almost curable with molecular medicines. And I think that's exactly where we're going in neurodegeneration, is that same understanding of the disease that will allow us to intervene and basically give people their dignity at the end of life. So I think, today is a special day for me. A week ago today, my mother passed away from Alzheimer's. We're going to celebrate her life actually tomorrow. I was a little bit concerned about sharing that video at the beginning. I thought maybe I should show it at the end to see if I could even hold myself together. But honestly, it's why we do what we do. I was very fortunate to begin my career working in drug development, first working on cancer, but was trained as a neuroscientist and have had so many personal experience around neurodegeneration from close friends with ALS. And then my mother started to develop memory deficits, as commented, it was 7 years ago. It's been an extraordinary week. And it's a unique feeling to be here in Utah presenting a little bit about Denali and our purpose, but I just want to emphasize one major point, like we're in an incredible industry. We get to solve big problems, and when we solve them, they have major impacts on families, especially on caregivers in the case of neurodegeneration. It's an enormous unmet need. It's not even worth sometimes showing this slide because when you think about pandemics, think of the chronic pandemic of Alzheimer's disease. There are arguably really no medicines that slow or halt these diseases. And we've really taken an approach using 3 principles. The first is simple, it's genetics. We call it the degenogenes. They're essentially the oncogenes of neurodegeneration, and we try to understand the mechanisms of the genetics. Some of you may know your genetic makeup, may know your genetic risk in Alzheimer's disease. I certainly do. In fact, it was a date night, which I think was probably not legal, where we did a little genotyping in the lab, not at Denali, and found out that indeed I carry the risk for Alzheimer's disease. I thought my wife would because her family has a long history as well of Alzheimer's disease. But these degenogenes, or genes when mutated that cause neurodegeneration, is a great starting point, much like the oncogenes as a starting point for developing medicines for cancer. The second, really the pieces of data I'm going to share today is engineering brain delivery. So inventing medicines to get into the brain. Our brains are very unique in that they protect us from toxins, but they also have to selectively transport essential nutrients. And I'm going to talk about that in a moment. And then the third area, which goes hand in hand, is biomarker-driven development. So using biomarkers basically to show that our medicines are working. These principles can be shared across all diseases, and I think they're critical for us to go after really molecular engineering and very specific molecular targets. So this is an image of the blood-brain barrier, and I'll just use my favorite analogy. The human brain has 400 miles worth of blood vessels. It's basically from our labs in San Francisco. I have to figure out where from our labs here in Salt Lake City. You can basically stretch all the way to Los Angeles in a single human brain. So your brain is completely full of blood vessels. But these blood vessels, as I'd mentioned, are evolved in such a way to protect us from toxins, create a microenvironment to allow us to signal and to store memories and to enact motor function and all of the above. And our approach really is to invent both small molecules, these would be oral medicines, or large molecules such as antibodies and proteins such as insulin for diabetes to cross the blood-brain barrier. And this diagram just illustrates really the algorithm that's used to pick small molecules that can readily cross the blood-brain barrier. And I just highlight here, just generally speaking, that it's all about the molecular properties. You need a molecule that can diffuse through those vessels. Now, this has been achieved, I'd say, over the last 40 years, and we're getting better and better, especially as we use different algorithms to predict the small molecule structure. But an area that still remains a massive unmet need is actually large molecules, and these are what we call biotherapeutics. And these large molecules I mentioned before, like human insulin, or antibodies that are engineered to treat cancer. And this has been a major challenge to get these large molecules across the blood-brain barrier. So what we've done in just really simple terms is that we've taken advantage of some of the natural transport mechanisms. In fact, the mechanism that's used to transport iron across the blood-brain barrier. You take iron in your diet, in order for it to get into the brain, it's actually transported through a receptor known as transferrin receptor. And we latch onto this receptor, it's shown there as sort of a butterfly-shaped structure, to get across these blood vessels, 400 miles worth of blood vessels. This is going to become relevant at the end when I talk about what we're doing here in Salt Lake City. So this is a diagram of basically a drug at the top crossing that blood vessel and then having access to your nervous system and an image of a single neuron. I'm going to highlight my probably most exciting day in my life as a scientist. And it was basically almost exactly, in fact, now I think about it, that video of me talking to my mother on the couch was on this exact day. I went to my parents' home and we interviewed my parents because I knew that my mom's memory was declining. And it was such an extraordinary day just to capture that experience. I left my parents' home and I got a phone call from Carol Ho, who's our chief medical officer. And she's like, "You're never going to believe it. These Hunter syndrome patients, these are young boys that have a lysosomal storage disease. Basically, they have normalized substrate in brain, which has never been achieved with a drug before. In fact, the early data I'm showing you here on the graph is actually just after 4 weeks of treatment. 4 out of 5 of those boys had completely normalized heparan sulfate. And you can see the 5th one just took a longer duration of treatment and a higher dose to eventually get normalized heparan sulfate. This is a substrate that actually accumulates in Hunter syndrome and causes neurotoxicity. And this was a big moment. I've been working on the blood-brain barrier since 2006, before we founded Denali. And I was already, let's say, a little bit touched by my experience with my mother, but it was one of those incredible moments where I went home and I looked at my wife and my daughter and son, and they said, "What happened to you?" I go, "This might be one of the greatest days." I mean, this is, as a scientist, to see this type of data. Now, what I'd like to show is the second piece of data. I promised only 2 pieces of data. It actually was really hard for me to put these slides together. I'm sorry, but this is one. And the second one is really more about the future, and I think relevant to what I've just shared with you in terms of my personal motivation in Alzheimer's disease. This is applying that technology known as the transport vehicle technology that binds to these iron transporters and applying it to an antibody for Alzheimer's disease. And this antibody binds a receptor known as TREM2 that's highly expressed on resident immune cells or microglial cells. And what's cool about this antibody is that when it binds to this receptor, it activates this receptor and it increases the number of microglial cells in your brain. So just imagine you take an Alzheimer's patient, hopefully very early stage, and you increase the amount of these resident immune cells, allowing them to clear the plaque and increase neuronal function. And the image I'm showing you here is basically showing that with the transport vehicle, we get much more drug in brain, but on the far right-hand side of the slide, these are newborn microglial cells that essentially can go about their activity, which become senescent in Alzheimer's disease. So we're really excited, in fact, to be moving this molecule very soon to clinical trials. It would be one now of 7 molecules that we're testing in the clinic. Obviously, the one I just shared with you in Hunter syndrome, but this one will be one of our first for Alzheimer's disease, and I think very fitting and exciting. So we have a number, as I've just highlighted, a number of programs. I like color codes. Blue are small molecules, orange are large molecules, and really exciting to be working on Parkinson's, Alzheimer's, Lewy body dementia, Hunter syndrome, and a large number of these devastating diseases. But in order for us to do that, we need to be located in the right place and be able to build the right team. And so we were founded in South San Francisco, and we have about 370 employees now. And just last year, after that data I just shared with you in Hunter syndrome, we made the decision to basically build our own clinical manufacturing and further expand our efforts. And we selected Utah, of all places, and to join the BioHive. And so, I'm so excited to be here. I would say what an incredible welcome to be part of this and to know all of you. And we look forward to participating for years to come. And with that, I thank you.